Hello, everybody, and welcome to today's webinar. We're going to be talking about best practices in virtual telehealth patient handoff workflows. I'm your host today, co-founder and CEO, Kiri Chitsi of One Touch Telehealth. We've got a lot to cover today, and so want to walk through the agenda and a few housekeeping items. We are recording this webinar. If you'd like a copy of the recording, please shoot us a note and we can get you a copy of that. There is a question that you can submit bar on your right-hand side. If you have questions throughout the presentation, feel free to submit those and we will do a Q&A at the end. In addition, we do have a handout at the end of the webinar on a new white paper. So feel free to stay around and grab a copy of that we will give at the end of that. So we're going to be talking today about the driving forces of telehealth adoption with COVID and the future of a hybrid telehealth and physical location model. We're going to be comparing today's physical brick and mortar workflows, today's typical telehealth workflow, and then best practices and virtual telehealth workflows. We are going to be showing a video of a live demonstration of how to replicate in-person workflows, how patients can virtually check in, do nurse intake, see a provider, and check out all in the same video consult. And then we're going to be going into some use cases for senior care and behavioral health and other industries, as that's going to be a little bit different than the typical practice group workflow that we're going to show in the video. And then we'll go over some best practices and takeaways, key ingredients of a hybrid telehealth model. So let's get started. As we all know, telehealth has really paved significant adoption and usage given COVID. Across the US, we've seen an increase in telehealth claim lines nationally by 4,347%. There was a report yesterday from CMS that they're just on the Medicare, Medicaid side, it was around 2,300%. And then different parts of the country, the East Coast was over 15,000% increase in telehealth. And as we looked at that and the driving forces of adoption, some statistics that I think are really eye-openers, as we look at some numbers that were released from Stanford's Children's Health, they went before COVID of 35 telehealth visits a day to over 500 per day during COVID. And the same if you look at the Cleveland Clinic, much larger, hospital clinic, health system, 3,400 to 60,000 a day. And we've seen that across, our clients, significant growth in telehealth. And now back, depending upon the state, back to a little bit more of a hybrid of seeing in person as well as doing telehealth. And then in some states, still 100% telehealth. Overall, medical practices have seen a significant drop in their patient volume. Folks are still scared to, come in for routine appointments. They're wanting to do telehealth or canceling those appointments. So it's super critical to keep those appointments and keep those revenue lines there while keeping your staff as well as the patient safe. There's been a 42% decline in ER visits. And so a lot of hospitals are really trying to determine, because they don't want folks obviously in the hospital with COVID. A lot of outpatient and elective surgeries have been canceled or are pushed out, as well as a lot of the Medicare and Medicaid demographic that use the ER as more of a, primary care, urgent care. A lot of that has significantly gone down. So there's a lot of opportunity for hospitals to extend the ability to do telehealth is there. And with our client population, we've seen, if you look up here, the top 25%, we do a patient survey at the end of all of our telehealth visits and across all of our clients and a lot of different types of medicine. 95% of patients are very or somewhat likely to want to use telehealth again. what this really says is there is a significant amount of demographics, especially your seniors and folks that haven't used telehealth pre-COVID, that there was a little bit of hesitancy to do telehealth, but once they did, they got comfortable with it and would do it again, which is significantly higher than numbers that we saw pre-COVID. So what are some takeaways? What are some lessons learned? What are we hearing that the key takeaways are from the COVID telehealth adoption? If we look back at March and we look back at April, there was a lot of short-term solutions that were made with the HIPAA being lifted. Folks were doing everything from, FaceTiming to using video conferencing tools to, whatever they could kind of piece together to try to see patients. That's really changed. A lot of folks have migrated to, a longer term strategy from a telehealth platform perspective. They've learned from, what's making them efficient or not efficient, and really started to look at that kind of out of that crisis. And then a lot of folks, given the winter and the number of cases going up, have started to really have that sense of urgency to get something in again. The video adoption, I mean, if we look to outside of the medical industry, video adoption is through the roof. I mean, with kids homeschooling and virtual schooling, with folks working from home and doing video calls from even, folks doing gym virtually or yoga, whatever it may be. There's been so much more exposure to doing video type calls, even with family members and virtual happy hours. It's kind of endless that people are really starting to get comfortable doing video and being at home and still being able to have that human connection. If we look at, revenue kind of down across the board, there's been a lot of statistics come out about how much hospital revenue's down, how much practice revenue's down. Patient didn't want to come in for routine appointments, for procedures, and it's also caused a lot of problems with people being sick and not seeking help. And so how do you really combat, making patients feel safe, still being seen, and how do you really prioritize what patients should be coming in physically in person versus what can be done via telehealth to limit the number of folks in your particular office? And then the last bucket's really the clinician adoption. There was a lot of providers, pre-COVID that were against telehealth just because of the unknown, or they felt like there needed to be a physical exam, or, therapists that wanted to sit across the table or couch from somebody. And this forced folks into having to do it. And now you get a ton of feedback from physicians that really do like it, and they like the work-life balance of being able to reach more patients, and the average being 7 minutes, or therapists that are typically doing hour-long therapy sessions that have now started to do 30-minute sessions and do them more effectively. And so, if you look at the patient satisfaction of not having to drive to appointments and feeling safe, and then you look at the clinician side of being safe and starting to like it, that really paves the future for, it's never going to be an end all where it's all telehealth, but it paves the way for a hybrid model and to really look at that. So here's a chart that we put together of the typical kind of in-office doctor visit. We spent a lot of time with our clients going through the physical workflow, the telehealth, and where their struggles were, which we're going to talk about, and then what does it need to be a long-lasting solution. So this is really more around practice groups. This particular one, if you're in behavioral health or hospitals, it's going to look a little bit different, but you'll get the picture. The patient's driving to the doctor's office. They're going to check in at the front desk. They're going to sit in the waiting room until the nurse calls them for their appointment. The nurse is going to meet with the patient, go over maybe some chart, medication, updated information. Then they're going to sit in the waiting room and in the physical office and wait for the doctor to come in to see them. Then their doctor is going to come in, going to do the whether it's an exam or, meet with the patient, whatever that may be. And then there's an appointment kind of debrief that typically, depending upon the practice, that can be with the nurse, it can be with the front desk on scheduling follow-ups or labs or whatever. And then the patient leaves and drives home. And that's kind of the end of that physical flow. Now, if we look at what's happening in telehealth for a lot of these short-term solutions, is the front, and everybody's is a little bit different. This is kind of a combination of what we see across the industry of how folks are handling it. Some folks are a little bit different, but in general, there's some type of phone call prior to the appointment to make sure, especially with certain patient types, to make sure that they got their telehealth instructions, whether that's a link or a text, or they have to be somewhere at a certain time. Usually the front desk is calling to make sure that way they're on time to their appointment, and they know in advance, they either have to download an app or whatever it may be. Some folks are having nurses call prior. Nurses are working from home, nurses are working in the office, and there's, a lot of times a phone call to update a chart, validate, if insurance is the same, if, there's a change in medication, what's going on with the patient today. Some folks are skipping that step. A lot of large practices are doing that prior to the call. And then the provider or the clinician, therapist, whatever it may be, is then doing the telehealth appointment. We're also seeing that sometimes that nurse and that doctor are running up against each other, as maybe the nurse only called the patient 10 minutes prior and they're running over, and the provider's trying to, is waiting for the patient to join, and there's a delay there. So that's causing some logistical issues right there. And then a lot of times there's a follow-up that might happen the same day, it might happen the next day, it might happen right after that the doctor needed you to go get some labs or wants to do a change in medication or whatever it may be. The front desk is following up, and a lot of times they're taking that copay over the phone, or maybe they're sending a link. But regardless, there's typically about 4 touch points in that flow. And so if we look at how to really optimize that, if we look at a lot of the feedback that we're getting from the providers, how can we optimize that virtual workflow to really replicate how it would be in person, and make it much easier on the practice group and the patients? So if we start this off and we say that the video consult, the telehealth appointment is initiated, it can be through a text link, it could be through a link that they're already got a reminder from your scheduling platform, whatever it may be. But having that call initially come into the front desk, the front desk goes on video. They might have you, hold up your insurance card to validate it's still good if there's a change in it, or they might update anything there, a quick one. And then they see in the telehealth platform that, the nurse is available, and they add the nurse to the call through a queue, not having to email the nurse or anything like that, but they add them right into the call. They do a nice transition, and then the front desk drops off, goes to the next patient. The nurse is able to do their intake information, and then when they're ready for the provider, so the provider's not sitting around, and neither is the nurse, they can make that warm handoff to the provider. Now, mind you, the patient is staying in the video call and not moving from that video call. So then the provider comes in. Now, some providers like their nurses to stay, do their charting, things like that. Other providers, will have the nurse drop off and the nurse might go to their next patient. Now, mind you, this flow that I'm going through here can go, doesn't matter where the provider or the front desk is located. The nurse can be working from home, in the office. The provider could be doing clinical rounds at a hospital, or sitting in the office, or sitting in their living room. It doesn't matter the way that this is bringing folks in and out of the flow. And then the last is, if they need to add back the nurse or they need to add back the front desk, It may not happen on every call, but if there's a circumstance where they need to go over, they can handle it right then and there on the call from that standpoint. And then you can send a link through messaging if there needs to be a link for them to go make a co-payment from the front desk and handle that right then and there versus having to send a phone call to take it verbally or send a link afterwards. And so that's what really, as we look at the future and we look at a true virtual workflow and having it contained within that one video call, really see that as being the future and optimizing the workflow for the healthcare organization as well as the patient, not having to have so many touch points. So if you look back at the previous slide, there's 4 touch points here. If you look here, there's 1 touch point within here with the patient. It's all being handled within a 7-10 minute call or longer on a behavioral health, or if you're bringing in multiple providers, but happening within that one interaction. So I know that diagram might be a little bit hard to follow of, wow, that sounds great, Carrie, but how does that really work? So I'm going to play for you how that actually works and show you here. So let's watch this and show you kind of how what I just showed you on the diagram. So a true virtual workflow today, I'm going to show a little bit of a different than an actual workflow to record this screen and show it to you. But essentially, I'm logged in as a front desk or a nurse, and the patient's going to come into the queue. Rather than going directly to the provider, I'm going to be able to do some intake information, whether I'm at the front desk or I'm actually a nurse, to be able to go over a few things with the patient instead of in today's environment of front offices or nurses having to physically call patients prior. As you hear that dinging, my patient comes into the queue, and so I'm going to accept and have a conversation with the patient prior to bringing in the provider. So I'm going to go in here, and my patient's going to come into the room here. Let me mute that. And so I'll have, his information pulled up in the chart. Hey, Pratik, how are you?
Hey, how are you?
Great. Want to go over for your telehealth appointment today with Dr. Combis. Want to go over a few things in your chart, review some medications, and then we will have him come in and do your appointment. And then when you're done with Dr. Combis, you're going to come back and we're going to close out, see if he needs to schedule any follow-up appointments, anything like that. So I would here then review the chart, go over some things with Pratik. And then when I'm ready, a couple cool things I'll show you here. When I'm ready, I have the option, obviously I can see Pratik here. I could also send him any private messages or group messages here. Maybe I need to send him a link, to some things for potential renal diet or things like that. But when I'm ready, as we're talking, I'm reviewing his chart, going over his history, if anything's changed. Instead of the provider waiting around, really to optimize this workflow, I'm going to go here, and I can invite any doctors, any licensed people that have licenses to the telehealth platform. Here for this particular appointment, Charles is the Pratik's provider. So I'm going to hit invite, and I'm just going to say Pratik is ready to be seen. And this is going to go the same way it came into my queue. It's going to go into Charles's queue, and he's going to know then maybe he's finishing up with another patient. He's going to have that pop out. He'll also be able to have a text notification, but he's going to come in, and I'm going to make a warm handoff to him when he comes in. And so he'll be talking to Pratika's patient. Now, when Charles comes in, you'll see that if I wanted, I could drop out as the nurse and just let the two of them talk. And then he could later invite me if he needed to come back in. Maybe they'd speak for 7 minutes, 10 minutes, whatever it may be. Or some providers like their nurse to stay if they're going to be charting for them. So now Charles is joining in. Dr. Combis, how are you?
I'm good. How are you guys doing today?
Great, great. Pratik's here. His records have been updated in the system. Would you like me to stay on or would you like me to drop off?
Yeah, you could stay on.
Okay, great. So then now Charles is going to talk to Pratik, his patient. He asked me as the nurse to stay on. But if I wanted to drop off, I could go over here and just give him ownership of the room, drop off, then him as the provider and Pratik as the patient would stay on together. As if Charles, Dr. Combis needed to invite another provider or maybe a nurse practitioner, he could do the same process that I just showed you. And some of our practice groups that are really optimizing their workflows will maybe then invite the front desk as well. So if Charles was done with the patient and he wanted to invite Diane at the front desk to schedule some labs, some follow-up, maybe even get payment, he could do the same thing and continue that flow, all while the patient stays in this one particular room with the security of being able to add and do people from that perspective. So that's really how to optimize a virtual workflow. It's going to be different for every scenario, whether you're in a SNF or a practice group or behavioral health. This flow may look different, and you might even want to bring in care providers, which I could do as well here. So if I was talking to Pratik and he said, hey, I would love my wife to join and kind of hear these lab results, I could go here and click and type in her cell phone number, invite her, or I could copy a link and send it through a patient portal, email it, whatever it may be, to invite a caregiver or somebody on the case management side. So that's really the virtual side of things, and we'll go back to the webinar, but this just shows you live how it really works. Thanks, guys. Look at as you watch that video and as we went through that, hopefully it shows a little bit more how that flow can work. And so now what I want to talk about is we showed it more from like a practice group side. Obviously, hospitals, it might be a little bit different, behavioral health, senior care. So I want to talk a little bit about how that also can work, especially with senior care, as we're looking at home health, hospice, adding caregivers. There's a lot of support right now going into skilled nursing facilities, senior living, long-term care. So as you look at that workflow that we just showed of how that actually works, the same applies for a lot of caregivers are making, medical decisions for their loved ones right now. And they have loved ones that are at home, that they're taking to appointments or trying to keep safe, as well as in long-term care or senior living facilities. And that's become more and more of an issue with COVID because you're not having doctors in and out of the facilities as much and things of that nature. So going over that same kind of flow, rather than bringing in people within your own organization, I could have just as well sent a text message to a caregiver to join the conversation or a spouse. And as if I'm a nurse at a long-term care facility, I could have invited the doctor when I was set up bedside with the patient, and invited a whole care team. So I could have invited, the primary care doctor or a cardiologist, or if it's a chronic care patient, maybe there's a case manager or, a nurse involved from that perspective. And so really, it also allows escalation. So if I'm a nurse in cardiology and we've got a patient on remote patient monitoring and there's some alerts that go off and I'm a nurse in a call center, I can talk to the patient. And if I deem that I actually need to get the provider that's on call, then I can add them in instead of having these multiple touch points of callbacks and things of that nature. Very similarly with behavioral health, as we look at what's going on in behavioral health and we look at crisis management or supporting school systems, or even there's a lot of behavioral health going on right now in senior living. And so a lot of times it could be a counselor that's bringing in a therapist, or bringing it that's not even in the facility or that location, but you can see that availability status. So if I go back here and you see these green dots here, I can see the availability status, to see who's logged in, who's available, things right now. As we look at that virtual workflow, that person can be sitting at home, they could be sitting in a physical office. It's really that hybrid model of bringing together that team. And so from a senior living facility, if I'm doing therapy with somebody in a facility and determine that they need medication and I need to bring in psych, I can see who's available. We might have 3 or 4, but only one's available, and invite them to join in and handle that all within the same flow from that perspective. So there's a lot of opportunities to really optimize the virtual workflow, to incorporate really a long-term hybrid model. So as we look at, the million-dollar question is always, where's telehealth going to be post-COVID? And it's hard for us all to think of what does post-COVID really look like right now. And I think because of patient preference, because we've exposed so many clinicians and doctors and so forth to telehealth, there's been a lot of really great things that have come out of it, to really optimize your staffing and workflow. So what does that really look like? So I think as you're looking at, however you're doing telehealth today, or if you haven't implemented telehealth today, you're at a good starting point to think about some of these things. So what are the best practices for really the hybrid model? Number one, you really have to look at it by appointment type. So as you're looking at what types of appointments that you have today, what types of patients that you have today, what can be done via telehealth to free up the waiting room to have less patients or more appointments and provide a better work-life balance for your providers, and what can't. So, if you need to do labs, or if you need to do a, physical exam, or, surgery, obviously that can happen via telehealth. But some of the post-op and pre-op can. And so really looking at those appointment types and saying to your front desk and your scheduling, which can be done, and offering that as a patient preference going into the next one is, one size doesn't fit all. A lot of seniors were exposed to telehealth appointments and really like it, but there's going to be, plenty of folks that don't want to have telehealth appointments, and some that make their healthcare decisions on people that only offer telehealth. So as you look at patient preferences, just as you do today do you want to receive a text reminder? Do you want a physical card? Do you want an email about your appointment? It's going to become a part of preference of what types of appointments you prefer. And so as you start thinking about your EHR, and as you start thinking about that preference, that's going to be something that's going to come to light, is what is your preference for a physical or a virtual appointment? And then as we look at workflow optimization, we've got, some good kind of experiences under our belt now that folks have kind of taken a little bit of a breath, and about to not have a breath again, coming winter season. A lot of best practices are starting to kind of be put in place. And then, what operational efficiencies can be gained? How do we rethink that workflow? And that's why, we've done this webinar and really virtualizing that workflow. And then in addition to that, the last portion is really expanding the business by being able to do virtual and telehealth. A lot of folks that have been marketing new patients, and kind of bringing on new relationships, maybe relationships with schools or long-term care or home health or things like that. it really allows to expand the business beyond the physical four walls, beyond that typical driving distance. And so folks are starting to think about that. It's a little hard to think about right now because you've got so many things, coming at you with managing patients during COVID. But that'll start to be, taken more into consideration. And then the last thing is really critical is the user experience. It really has to be easy across all demographics. The litmus test is always, can your, parents join easily? If you were to hand over your process to your grandparents or your parents, could they be on time to their appointment? So there's been a lot of issues with downloading mobile apps and having to create profiles and even trying to get a senior to know, an Apple iTunes account password to download an app or a Google Play is a showstopper because they're typically not the ones that set that up. Their kids or their grandkids did. And so really thinking about those experiences, thinking about how many clicks it takes them to actually connect, what they're having to remember, things like that, will really help put your clinicians in being able to practice medicine and not being tech support, and will really take the task off of your front desk from getting phone calls 1 second before an appointment of, they can't connect or they're late. And it puts a real bad taste in clinicians' mouths of patients being late for appointments. And so if you're hearing any of those types of things, that's probably because of the user experience bucket from that standpoint. So lastly, we're going to go over any questions that you might have. And Charles is going to push you guys a handout. If you have any questions, if you want to submit any questions that you might have, and we'll address the ones that we have from that standpoint. If you have any questions, feel free to submit those. We'll try to answer them. And then if you have any additional questions, you've got my contact and personal contact information here if you have any further questions. And then hopefully we'll wrap up and give you a few minutes of your day back from that standpoint. So the first question I have here is, for healthcare professionals that are using video conferencing, do you see that as being a long-term solution? You've probably, if you've heard me speak before, if you've read any of our white papers, and actually it's addressed in, I think, the white paper that Charles is pushing to you, but video conferencing was really meant to be for internal communications. It's great for conference calls. It's great for, kind of sharing your screen and so forth. And yes, a lot of people have been exposed to video conferencing with COVID for work or personal things like that. However, it depends on your patient population. It's definitely kind of takes it outside your patient journey where you can't kind of control the workflow. And, there is still a large population that's going to have to download an app or create a profile. And so there's some obstacles there. I would say if you're a solo provider or you've got a really small practice, just 2 or 3 docs, it probably would work okay for you if you're willing to kind of do some of that tech support. But for larger practices, things like that, you typically will not see it there. You do see a lot of video conferencing being what is used in your EHRs. If that's white labeled, it's typically video conferencing. But you won't see a lot of larger groups using that just because of the workflow and what's required from that standpoint. The next question, do I think there's going to be a higher surge on telehealth given the number of cases have gone up? I think we'll probably, that's funny, I get the question probably multiple times a day over the last couple of weeks, especially given the news and the number of cases going up. I think, we still have a lot of clients that, by state that are still closed down, that are still doing, 90% or 80% telehealth right now. I think for some of the states that have opened up, and those clients are doing 60% telehealth or 40% telehealth, I definitely think those clients will have to go back up in the number of telehealth. And then I think for the folks that don't have a telehealth solution in place, I think we'll see a secondary kind of surge on that if some of the states start going back, restrictions from that standpoint. So if you have any additional questions, I'm happy to answer them. You should have received your handout that you can download there. And so this wraps up our webinar today. I want to thank everybody for joining. Feel free, if you have any questions, to reach out, and feel free to follow us on social. We do have webinars. And if you would like a copy of the recording today, please send me a quick note and I'll make sure you get a copy of it. Thanks everybody for joining, and have a great rest of your day.